Cleaning and shaping is the most important phase of root canal treatment. In this video, you're going to learn how to clean and shape root canals with a combination of hand and rotary instruments. Here is the buccal view of the first mandibular molar with a sinus tracheostoma and the lingual view of the posterior teeth with a recent second premolar extraction. A periapical radiograph shows presence of lesions around the roots of the first molar. After administration of local anesthetic, rubber dam is placed in this region. Please note 2 points. 1. The clamps are placed on the adjacent teeth to the mandibular first molar for better visibility during this demonstration. And 2. Oroseal is applied around the margins of the first molar to prevent leakage of irrigation solutions to the wound site. To minimize chipping and cracks in the porcelain crown, access preparation is initiated with a diamond burr in a high-speed handpiece and copious water spray. After removal of surface porcelain, access preparation continues using a number 2 round burr in a high-speed handpiece to penetrate through the metal and into the tooth structure. The access is enlarged using a Fisher burr in a high-speed handpiece and water spray. A number 6 round burr in high-speed handpiece is used to penetrate through the roof of the pulp chamber. With the use of the same burr, the pulp chamber is unroofed completely. A large diamond burr was used to flare the access cavity walls. This action has allowed straight-line access to the orifices of the canals. After depositing sodium hypochlorite solution in the pulp chamber, a number 10K file is placed in each canal. With a very light 1 to 8 to 1/4 turn and push and pull strokes, this file is taken to the estimated working length. The canals are irrigated with sodium hypochlorite solution to remove debris. A number 10K file is then used and the canals are irrigated again. Similar actions are performed with a number 20K file. With the same motion, number 25, 30, 35, 40, and 45K files are carried into the canal as far as they can be inserted passively. If you cannot go to the working length, do not force the instrument. Be passive. After passage of each file, the canal is irrigated with sodium hypochlorite solution to remove debris. Remember, the purpose of the use of these files passively is to establish apical patency and flare the canals coronally. A number 2 Gates Glidden drill is inserted into the mildly flared canal to a point where it binds slightly. It is then pulled back about 1 to 1.5 millimeter and the slow speed handpiece is activated. With an up and down motion and slight pressure, the canal walls are planed and flared away from the forcation or danger zone. The pulp chamber is irrigated with sodium hypochlorite solution to remove the generated debris. A similar technique is used to plane and flare the coronal region of each canal with larger Gates Glidden drills. Do not force the gates into the canals. Use them passively in the orifice of each canal. The depth of penetration decreases as larger gates are used. The root canals should be irrigated with sodium hypochlorite solution between the engine-driven instruments. Note the presence of straight-line access after using the Gates Glidden drills passively in the coronal portion of each canal. With the use of similar techniques and precautions described for the use of Gates Glidden drills, a number 2 and 3 piezo reamers may be used to flare the coronal portion of each canal. Flaring the coronal portion of the canals causes deeper penetration of irrigation solution into the canals. Again, use these instruments passively in the orifice of each canal and plane the walls away from the furcation. Reduce your depth of penetration as you move to the larger piezo reamers. The pulp chamber is irrigated with sodium hypochlorite solution to remove the debris from the canals. The orifices of the mesial canals as well as the distal canal can be seen after coronal flaring with files, gauge splitting drills, and piezo reamers under an operating microscope. After placing a number 15 file in the canal, the working length is established by choosing a reference point for each canal and taking the file to the working length using an electronic apex locator. The working lengths are then confirmed radiographically. The rotary file for this case is a NiTi profile with an 04 taper. The apical portion of the mesial canals, which happen to have the same working lengths, is enlarged to their working lengths using the smallest rotary NiTi files. The next size files are then used to the working lengths of the mesial canals. The rotary files can be dipped in RC prep as a lubricant. The apical portion of the mesial canals is shaped using the next size rotary files. The canals are irrigated with sodium hypochlorite between each file. Because of presence of mild curvature in the mesial roots of this tooth, the apical portion of these canals is taken to one size larger. The canals are irrigated again with 1 ml of sodium hypochlorite. With the use of larger rotary NiTi files, the coronal portion of the mesial canals is flared progressively at successive shorter lengths with increments of half to 1 millimeter. Note the fact that the rotary instruments are used passively and short of the working lengths. The prepared canals are irrigated again with sodium hypochlorite. The apical portion of the distal canal is now being cleaned and shaped using 04 NiTi profiles. A red-coated handle file is placed to the working length. The distolingual cusp is used as the reference point for this canal. The canal is irrigated with 1 ml of sodium hypochlorite. The apical portion of the distal canal is now shaped using the next size rotary NiTi file. After irrigation with sodium hypochlorite, with the use of largest rotary NiTi file, the coronal portion of the distal canal is flared more and short of the working length. After irrigation with sodium hypochlorite, each canal is prepared with sequential use of progressively larger hand instruments to its working length. Start with a number 15 file and go up to larger sizes at the working length. Again, narrow or curved root canals should not be enlarged beyond the size number 25 or 30 files. Larger files should not be forced into the apical portion of the canals. They should be used short of the working lengths. After apical clearing and irrigation with sodium hypochlorite, each canal is dried with paper points. The tip of a large metal or plastic needle is passively placed in each canal, and the paste is slowly and passively placed in each canal. A cotton pellet is placed in the pulp chamber over the paste. Cavity is then packed into the access opening and pressed against the access cavity walls. The surface is smooth with a moist cotton pellet.